My name is Dr. Abaid Sajid. I'm a first year GP registrar at DPV Health. Ever since I can remember, I've always wanted to do something that would make an impactful difference. And medicine kind of became that pathway I wanted to take.
So I'm Meg, I'm one of the GP registrars. I've been a doctor for 4 years now. I'm in my first year of GP training. Didn't always think I'd end up in general practice, but after a few years in the hospital, I realised general practice was exactly right for me.
I feel like joining DPV, one of the things that drew me to it was the huge community aspect that was surrounding it. I personally enjoy community medicine only because I truly believe that if you do it really well, it prevents a lot of unnecessary hospital admissions down the track. You get to build relationships with these patients and also their families.
We get exposed to a lot of refugee health and chronic disease management, which is very good for my learning and also very rewarding to be exposed to people from different backgrounds.
I'm Ines Jigaf. I'm from Libya. Me and my family moved to Roosevelt, and my friend recommended me to go to DPV Health as it was affordable and community health. And I went there and I heard about advisory group, and I decided why not be part of it. I have worked with different communities, different culture, and I know the challenges that they face and how I can bring it to the DPV Health as someone who serve the community and know what they need.
My name is Fathiya bin Ziglam. I'm from Libya. I'm now a volunteer member of Dental Consumer Advisory Group. It's an opportunity to represent the voices of community members. Even small suggestions can make big difference.
DPV holds a very, I would say, prestigious position in our community because, there's not many bulk billing facilities left. They've got so many specialties within the confines of DPV.
My name is Lakshmi. DPV Health got a lot of services. I go to hydrotherapy. Still, they give me some exercise that I do at home. Hand vaccine, I got arthritis all over my hand. That did help a bit. I do appreciate all the staff. They were very caring and helpful in all the way.
My name is Ismuna Muhammad Abdi. I came from Somalia. Ilyas, he was my first child. He crawled normally, he walked normally, but when he was 10-2, he stopped everything. When I called his name, he never responded. He never came to me. When I saw Ilyas have some sign of autism, I felt bad. I said, can you do my son verbal assessment? She said, yeah, it seems like Ilyas is autism. Since when we start seeing DPV Health and they did their assessment and the diagnosis, I just relieved because already the doctor, she said, NDS and everywhere, Ilyas will get support. And I feel happy because I feel like now Ilyas is in the right position and will get the more extra support.
So I feel I create a genuine impact through being able to guide young women in making the right choices for them, for their sexual and reproductive health. One of the patients that I've seen a couple of times came to me early on in my time here with an unplanned, unwanted pregnancy. Felt she couldn't reach out to her family for support. We spoke through her options and her choice was to terminate the pregnancy. So we went ahead with that, and then from that opened up a discussion of longer term contraception. Now that patient is a regular patient of mine.
I had a 10-year-old boy that came from Syria. I was supposed to do a health assessment on this child, and on the notes it said that he can't walk or there's undiagnosed, not sure what's wrong with him. I took one look at this kid and it looked a lot like someone with cerebral palsy, which is a really devastating condition to have and it's very debilitating. And I think about this a lot because he went through this war-torn country. The dad had 5 kids, didn't know who to, prioritize, what to look at. Turns out this child was only on these supplemental drinks his entire life, so he hadn't even had a proper meal. But I rung up Royal Children's Hospital, spoke to their refugee team, and ran the case past them. And, they were so helpful. They said, we want to see him straight away. And I still see him now, and he looks a lot healthier. He's got the right support. I remember the dad saying to me, no one's ever spent so much time on my child before. Every time I feel as if I'm not making a difference, I think of him. And it gives me a bit of reassurance that, look, what we're doing is making a difference.